Hi, good evening. My article that I'm going to discuss with you today is called Gastrointestinal Issues in Autism Spectrum Disorder. Individuals with autism spectrum disorder displayed a wide range of neurological comorbidities, including intellectual disability, epilepsy, anxiety, mood disorders, as well as non-neurological comorbidities, including blood hyperserotonemia, immune dysregulation, and GI abnormalities. People with ASD have multiple underlying causes and developmental manifestations. The diagnosis is based on standardized behavioral assessment. There's no clear understanding of mechanistic basis of autism spectrum disorder. Therapeutics for treating autism is limited. Most drugs prescribed to people with autism are used to treat autism-related conditions such as anxiety, hyperactivity, epilepsy, and OCD. Most common GI issues that are found with people with autism spectrum disorder are chronic constipation, diarrhea, abdominal pain. And then some that have ASD experience elevated levels such as acid reflux, bloody stools, vomiting, and gaseousness. And then there's also intestinal pathologies that are associated with people with autism, such as enterocolitis, gastritis, and esophagitis. Food allergies, altered dietary nutrient intake, and metabolic disruptions have been associated with people with autism spectrum disorder. Autistic individuals with comorbid GI abnormalities exhibit altered carbohydrate digestion. Again, all of these issues with GI dysfunction can contribute to the manifestation of core symptoms of autism. Autism is believed to originate from a contribution of genetic and environmental risk factors. Certain single gene polymorphisms, as well as copy number variations, chromosomal abnormalities, are all genetic contributors to autism spectrum disorder. Environmental factors also are contributors to autism spectrum disorder. There has been a link with maternal use of medications called tetrodotoxins, which are meds that are used to treat seizures and bipolar disorder and migraine headaches. Autism-associated GI abnormalities can contribute to the manifestation of core ASD symptoms. There's also the gut-brain connection, gut-brain axis. The GI tract and brain communicate bidirectionally to regulate a variety of functional processes. Several direct and indirect mechanisms potentially mediate how molecular alterations in the GI affect brain development and function. Changes in GI microenvironment can alter the intestinal lining of the intestines, which extends into the brainstem. GI disorders are strongly linked to GI inflammation. GI issues that result in distress or discomfort can potentiate problem behaviors, self-injurious and stereotypic vocal or motor behaviors. For example, abdominal discomfort in people with autism may be related to presentations of abnormal mouthing or posturing behavior, self-injury to the abdomen or other areas to detract from. The intensity of particular abnormalities is reported to correlate with the severity of core autism behavioral symptoms. So GI problems can contribute to autism-related behavior. Autistic kids with comorbid GI symptoms display more severe irritability, anxiety, and social withdrawal. And so that supports the gut-brain connection. As I've mentioned before, people with autism spectrum disorder follow a casein or a gluten-free diet. And when they follow this diet, it helps reduce their behaviors. Other treatments that have been used to reduce behaviors in people with autism spectrum disorder, there's one called inclusion, which is also hypothesized to elicit behavioral effects on intestinal lesions by preventing immunological responses against casein and gluten in the GI mucosa. And also antibiotic treatment has been reported to improve autism symptoms. So in conclusion, whether dietary or probiotic treatments can be used to relieve GI symptoms, ameliorate immune dysregulation, and improve behavioral symptoms in autistic individuals should be further evaluated in large, well-controlled studies. And that is the conclusion of my article. Thank you.